Hey folks, welcome back to Transplant Helper again today. My name is Jim Merle, and today we're going to be doing kind of a follow-up video to one I did about a year ago at this time entitled Forbidden, what they never tell you about organ transplant. Now, that video in its time was pretty popular. It's actually had a little bit of a resurgence as of late. There have been a number of people going and viewing and commenting on that video and such as that. And so I determined it might be time for kind of a follow-up to that, just kind of going back through and seeing what you're thinking about now, so that we can make sure that we give all this information out so people can be the best prepared they possibly can if they're awaiting any type of organ transplant. Most of the comments, they'll be concerning heart transplants, but I think also many of them will be rather universal. Now, I'm going to tell you up front, I got my information off of my favorite heart transplant support group. It's actually called that over on Facebook, Heart Transplant Support Group. But my favorite group, it consists of about 10,045 members, time of this recording. And the thing that makes that group so wonderful and kind of puts it above all the rest are the amount of participation that goes on every single day. I would say on any given day, there are about 35 or 40 posts that are put up there in that group. And I've never, to this point at least, in all the years I've been in this group, a part of it, even as an admin, a moderator at one time, there's never been a time when I didn't see someone post a question or a statement that they didn't get tons of feedback immediately right below that. The comments just come flooding in. So it's a real support group where you can get a lot of great information from people like you and I who have been there and are currently, watch this word, doing that. We don't want to be done that, so we want to be doing that. And that's what we are, living survivors, a part of the Transplant Helper community. And in this case, a part of the Heart Transplant Support Group. Now, the way I've been out doing this, I actually put up a post the other night, knowing I get a ton of feedback concerning the question that we relate to our video today. And that question was, can you list a few things that you wish would have been talked about more before transplant? Or another way of saying that, what do you wish you would have known? That's the question I posted. Again, like I say, it probably took 2 or 3 minutes, and I was already getting people flooding into the comments there, giving some feedback on that. And over the course of the last 48 hours or so, about 2 days, it's just filled up. The comments are just loaded there. So I thought we'd kind of scroll through some of those and share some of those here in order that we might get a better understanding and we can kind of communicate and collaborate on these things. Okay, so I think that's one of the better ways to learn, again, from a been there and doing that perspective. We're all family in here anyway, so let's just share some of these ideas. Now, with that being said, I'm going to be posting some of the comments just temporarily up here on the screen, the ones we're going to be going through. And I'll tell you up front, I'm not going to get to all of them. That's for a couple of reasons. One, there are a ton of them. But two, and mainly because a lot of them are kind of the same comment. Okay, we kind of all get down to similar things, such as being shaky after transplant. We'll discuss that, but we won't look at all of those. And the thing that really impressed me about this, you'll see some of this, is again, when someone would comment, it wouldn't be but a moment, people would reply to their comments. The threads would just keep swelling and growing, people coming back and supporting and agreeing with one another and such as that. In some cases disagreeing, but we'll see that when we get to it. But I think all of these are very beneficial. Yes, I think every one of these can fall under the category of the things they may have never told you about organ transplant. Not necessarily forbidden like the last video, but certainly things we may not have known. So hopefully you'll get something out of this. Now, we're going to jump in the comments right quick. The first one of these, I want to come right from the top, comes from Howard Beeson, and he says, how shaky I would be from Tacro and that it would resolve. Now, this is that comment. There are a ton of these like this. So this is that particular comment that just comes up over and over and over again throughout this. And I don't think any hospital really did any kind of a job relaying that. Now, I at UAB, I'm a transplant educator there, so of course I'm going to speak highly of them, kind of biased. But at UAB, I think I got a tremendously great pre-transplant training sessions. There were a number of those. The evaluation had that as a part of it, that there were some training sessions. I think I got given a lot of great information, but I don't believe anybody ever said, hey, you're going to shake like a leaf on a tree when you get this Tacro / also the Prednisone. That corticosteroid Prednisone gets in there, and those two working together, tacrolimus, aka Prograf, and Prednisone, man, those two clashing can cause a storm of tremors and shakes. Almost has the look of Parkinson's, or at least look as if, you know, you've been on a lot of caffeine all day and such as that. And Howard says that, and then all the people that comment below that go along and say, yep, been there, done that, have the card to prove it. Now, in my case, The way I often described that back then is I talked about how it almost felt as if I'd taken some sort of a carbonated drink, I'd imagine like a Sprite because it was clear. I thought that if I'd stick my finger down in it, the internal shaking that was going on would vibrate that drink so much, it would just boil over, just foam over out of the glass. And that's what it felt like. You know, the difficulties, I couldn't eat rice, I couldn't eat peas, I couldn't eat anything on a spoon hardly for a while because it was just that aggravating. But as Howard made mention of here, he said, and that it would resolve. And that's the wonderful thing. It typically, that's my key word here, does resolve over time as those dosages come down, both the tacro as well as the corticosteroid prednisone. As those dosages come down, it typically does resolve, at least for the most part. Now, I did find a few people here in the comments and some that even commented on the video that I did the last time that, hey, mine hadn't resolved. I think one person I recall said she's been about 8 years out now. She still has difficulty with that. And I'll tell you, I do too from time to time, depending on if I'm fatigued or maybe I didn't eat well, or sometimes I drink too much caffeine, which I don't drink coffee and all, but sweet tea is my addiction. And if I drink too much caffeinated sweet tea, it'll cause me similar problems. And I really hate it now because I just don't like that feeling. When you live with it for so long, you just don't like that feeling. But that can happen. And sometimes that's fatigue. Sometimes it's diet related. Sometimes it's just because your tacro levels, even though you take them, as most of us do, in 12-hour increments and try to be very cautious and careful of that, those levels do fluctuate a little bit. And depending on if the tacro is a little higher, a little low, you're going to have that return of the tremors or the shaking sometimes. So thank you, Howard, for that. In the next place, I'll scroll on up just a little bit. Lacey Stevens says here how heavy I get from the steroids. And yeah, I think many of us can kind of feel her, and many did chip in with information about that. And yeah, that's the truth. You know, this corticosteroid prednisone, I call it the devil's drug. I've done a ton of videos on that. If you want more information, I'll put them up here in the corners in the description below. But that particular drug does cause weight gain. It causes extreme hunger in some of us, which can be a good thing early on, because when you come out of surgery, sometimes you lose your appetite, you lose your taste buds. That wasn't even mentioned here that I recall, but that happens too. And so sometimes you need the motivation to want to eat and to want to move forward in life and such. But man, you can pack on the pounds quickly with that, particularly the dosages we are often on. I've seen examples. I've been on 65 milligrams several times a day in the early stages of that. And until that comes down to that, what we call the maintenance dose of 5 milligrams, or thankfully I've been off of it now for almost 7 years. It continues to happen, and you kind of get in that habit and you pick up weight quickly. Now, I actually, believe it or not, I actually lost 25 pounds on prednisone, but there's a little secret to that. I had 25 pounds of fluid on me at the time of transplant, so I lost all that fluid off while on prednisone, and thankfully I was able to maintain even while on it. But that's something you just have to really work through. So I feel for you on that, and we've all kind of share in that one to a point. Now, one of the things that adds to that, at least to that feeling of being heavy, as she said it, is the moon face that can come. Sorry about that. The moon face that can come with prednisone sometimes, or most of the time. And that gives you that look of a chipmunk, you know, like Alvin the Chipmunk, and really makes you feel uncomfortable and sometimes self-conscious. And again, that often does come down with those steroids. When they come down, it comes off, and that kind of helps with that feeling of being heavy. But that is a part of what we deal with sometimes. Now, J.J. Osman said how you'll never get back to normal. That's what he said, how you'll never get back to normal. Now, a lot of the comments that came in below this, which I 100% agree with, JJ, you're right. You never get back to a 100% normal, as in you may not live a life exactly like the person next to you. It may be your spouse. It may be a family member, a friend, a coworker, whatever. You may not ever live the life that they did. But like several commented and chimed in on that really quickly. Sue, for example, she chimed in right below your comment and said, yeah, but normal is relative. And it is. Normal is certainly relative in this case. For example, I was a congenital heart patient, so born with a defect right there. What I thought was normal wasn't normal at all. And so me now, being 11 years post-heart transplant, I feel great in comparison or relative to that. I'm not 100%. I have good days, bad days, ups and downs. I discuss that often on the program as well. But relative is, to some extent, normal for us, or there is a relative normal, I should say. And that's just kind of thing we have to learn. And I know that you're not frustrated with this, but I think we should be told that more. We should be at least pre-warned, maybe. We want to be positive in all these things as best we can. We want to keep people upbeat. And, maybe they should set us down in part of those evaluation classes and say, hey, look, things are going to be different. Maybe that's the word. Things will be different after transplant. Maybe that would help a little bit. I noticed what R. Kelly Wagner said, and I like what she said. She commented back to JJ and said, I'm a heck of a lot better than I was back then pre-transplant. She mentioned she's now 70 years old, which R. Kelly is, man, she is a warrior. If you don't know her, I think one of the admins in this group, she definitely has got a lot of great information. So if you're ever needing to know something, she's got the answers most of the time. And she does a great job. But yeah, it is relative, again, is the idea there. And it is true in that case that, it just depends on who you are, where you are, and where you are in that case, I think, coming from. Okay, let me see right here what I have. Kind of skipping through a little bit of those so we can go to a totally different question. Here's one, comes in from Tammy Willett. I'll try to read some of it very quickly. She said that there was a possibility that my leg wouldn't work when I woke up. After months of therapy, I did regain feeling and was able to walk again. That's kind of the first part of hers. And then she mentions the prednisone weight gain, how it comes on a lot easier than it goes off. True to that. But let's talk about the leg for just a moment. That does happen a lot of times, particularly if someone has been on an ECMO device. I don't know that you were necessarily on that, but a lot of the tubes and things that go in, the support tubes, the drains that come in sometimes can kind of hit on nerves, is my understanding of that, and can cause you to lose function of body parts. For me, it wasn't the total loss of a leg per se, but I got a spot about that big, about the size of a New York strip. Maybe that's not the way to talk about that, but up on my thigh, I got a spot that was just completely numb to one extent, but at the same time, it was a hurting kind of numb. It burned. I mean, it hurt bad. And I woke up after transplant with that. And even with my chest cracked open and all that had gone on, my ICD having been removed was fairly painful, that sort of thing. The cavity left behind there because it had grown in the muscle. But the worst thing I had was that leg that just hurt all the time. They put me on tramadol, different muscle relaxers. They tried everything. Couldn't do anything with it, really. Time had to heal that. But thankfully, it was very positional. If I'd lay a certain way and move a certain way, it hurt really bad. But if I could move a certain way in the opposite direction, sometimes it would get better. But I did have something that happened maybe similar to what you did, Tammy, and that is after one of my heart caths where they went in through the groin one day. Of course, they numb all that area up. And I had laid there after that cath, maybe 2 or 3 hours, whatever the protocol was, and tried to get up out of bed. I thought I was fine. Tried to get up out of bed and just dropped straight to the floor, collapsed. My right leg would not work. It was dead. And what had happened in that case, not like yours, but I think the same sensation, some of the deadening medicine they put in there had gotten on a nerve or something like that, so they explained. And yeah, I collapsed. So I can imagine what you went through, months of physical therapy to get back to that. I'm glad you have made progress and that you no longer live in that place. So thank you for that. A lot of people, again, commenting on that and even mentioned, let me go to this one. Let me see. Tammy mentioned it, but also Julia Rodney is talking about it down here. You definitely find out who your true friends are after transplant, even family members sometimes. Yeah, that's the truth. And I've done entire videos on that we just have to be prepared. Again, I want to be positive, okay? Please understand me. I want to be positive in all this. And my transplant education I do face-to-face at UAB and try to be on these videos too is positive, upbeat, encouraging. But at the same time, I think it'd be good if we were better prepared for that people in our lives, and it could be friends, family members, co-workers, whatever, even close family members sometimes they tend to vanish into the abyss sometimes after our transplant. That could be for several reasons. One, we're high maintenance sometimes, at least immediately after transplant, the first 6 to 12 weeks and longer, we can be very high maintenance. And sometimes people bail on us because they don't have or choose to take the time to assist. And that's why in the pre-transplant evaluations, they're always so careful to try to establish, do you have a support system? Do you have members of the family that can be there with you 24/7 24/7 and assist in any way. But unfortunately, that doesn't always work out. People have their own lives. They get frustrated. They back out in a different way. And I think a little bit more positively, although unfortunate, a lot of our friends sometimes tend to bail on us because they just don't know what to do or say. They get uncomfortable with us. And I've always hated that feeling of being treated like the sick boy. Jim, we won't invite Jim to do this because he won't be able to do it. Or his diet's probably changed. He don't want to go eat, don't want to go out and eat Mexican with us or anything because he don't need the sodium. And they make up a scenario in their minds sometimes of how we should be treated or ought to be treated, and it's frustrating right there. I tell people sometimes, I've done videos about this, by the way, as well. 1,000 videos, you do most of the things, right? But I tell people sometimes, I don't like it when I see someone I haven't seen in 6 months, and the first thing they say is, "How are you doing, Jim? Are you okay? Are you doing better now?" They kind of talk to you like that. Not literally, but sometimes it feels that way. Frustrating there. But sometimes people are not going to be able to be there for you for different or various reasons. And let's see here. I'm going to go one to Teresa Dennis, list right here. She's replying back to Tammy. It looks like a little bit here. She says, "I understand that. Even though after 16 years, I have times where I feel like I'm stuck in a revolving door of people. I make friends and do things together, and then they cancel plans, or I have to cancel plans sometimes even because my body's exhausted. I just can't do it. People don't want to understand the complexity of transplant." And I would add to that, she didn't say this specifically, but a lot of times after transplant, you get both sides. I've kind of complained about one of them, "Are you okay?" Kind of that feeling. But on the other side, people treat you like you're all better sometimes. And that doesn't work out. Those two extremes, you're all better. You ought to be all better. I mean, you had your transplant, last week? You're doing great, right? No, not yet. It's going to be a process. It's going to take some time. And stuff you just have to work through. It's difficult, though. It's really disheartening sometimes when your support system, your friend groups kind of taper away sometimes. And hey, here I am. I'm 11 years post. I'll be honest with you. My friend group of good friends that I have consists right now of one. Okay, we'll say two because my wife is number one. But outside of my family, people who live under my roof and my parents, my friends, about one man. He happens to be 89 years old, believe it or not. He's probably my best friend in the world. I have other acquaintances I get to see some, but for the most part, and some of that's on my side of things where you disconnect from people, but you just lose sometimes on that. Now, let's move on to another one here. Now, this is from Mark Johnson. Mark Johnson's a great friend. He's had a number of struggles, but he's had a number of triumphs as well. Mark said that it is quite common for your chest to remain open even a few days after transplant to allow the swelling to go down before closing the incision. And Susan comes in and said, "Yep, happened to me, been there, done that as well." And that is one of those things. Now, this is the worst of the worst, and I'm trying to be positive here, but at times after transplant, because of bleeding, swelling, different situations, they do leave that chest open. Okay, now they'll put a patch, if you will. I don't know what you call that, but a gauze thing, a sticky thing. They'll pull it together and all. But as far as wiring that sternum or reconnecting that sternum and sewing you back up, sometimes you do remain open for a number of days or weeks, even at times. And it sounds terrible and it's not fun. But yeah, that is a possibility. I think if they I don't know. It's hard to make a call on this. I do agree with you, Mark, but I think we should probably at least be warned about that because, man, when they do that, leave you sedated, see, so the person there doesn't necessarily know it, but the family, wow, what a shock. They call and say, "Done with surgery, he's in recovery. Oh, by the way, we left his chest open." Wow, you don't tell people that, but it does happen. And so, yeah, Mark, good comment right there. And yes, that's certainly one of the things we don't talk about enough. Here's another one here. This comes from Nikki Schultz. How the recovery is different from a regular open heart surgery. Now, Jennifer comes in and says, "Can you explain that?" Nikki adds, "Transplant was my 5th open heart surgery." Wow. And the recovery from transplant was way, you talk like me, Nikki, way longer and tougher. Not only are you recovering from the surgery, but from the drugs, the ICU Delirium, which, by the way, that one is going to be a trigger in a moment. ICU Delirium, that's very common. And the way your body has to learn to operate with your new heart. I love my new heart, but the journey after surgery was very rough. Used another very in there, Nikki. But yeah, that is the case. Now, no open heart surgery is a walk in the park, okay? It's not a bed of roses, but transplant's different because you are healing. There's so much healing going on. I've told this story before that 3 weeks after my transplant, I came over into my one of my follow-up appointments. I was complaining 3 weeks in. I was complaining to my transplant doctors that I didn't feel well. I was having trouble, and I was just frustrated. He said, Jim, you were sick for 30 years. It's been 3 weeks, and you expect to be all better. There's so much. There's a lot of trauma, really, that's going on in your body, both physically, emotionally, which we'll get to some of that in a moment. There's a lot of stuff going on, a lot of healing that goes on. It takes a ton of energy out of you. Just about every wink of sleep, every bite of food that you take goes 100% to that area to heal and to recover. And it's just a lot. There's a lot to deal with. On top of mentioned here, the medications and all that were a part of that. Yeah, that can be very, very, very tough. And I'll move on to another one here because they bring up the next subject we've already mentioned. But Jason Crutcherly, I'm sorry if I mispronounced that, says ICU Delirium. And boy, Jason opened up a can of worms with this one right here. There are a number of people who definitely felt that way. Rob Goodwin talks about how he seriously thought he had permanent brain damage. John Elm talked about he felt like he was kidnapped by aliens. Kim Jackson gave a lot of information here and says that everything seemed so surreal. It just didn't seem real at the time, and says that even now, 11 months post, that she's still struggling with some of that and wondering if she's ever going to get her memory completely back or whatever. But yeah, the struggle is real on that. I've got a couple of videos about ICU delirium. I'll tell you this, that's not been there doing that for me. I have not experienced that, but I have witnessed it because I've gone into CICU so many times. I've visited with patients. Wow, unbelievable what people can go through, and it is so real. I'm not even going to say you think it's real. It's real, folks. If you're experiencing something to that level, to that extent, that's fear and panic and not being able to comprehend or understand is so real. But I've got a video that helps, at least with the family side of things, on how you can help with that. And really, it's more for helping the family get through watching a loved one experience it. But Kim, to you, to Jason, to everybody else, there are more comments right here. It just keeps expanding out. Let me see. Cindy Arden Benton says, my husband had artwork from the grandkids on the wall, and he thought that they were walking around all over the room. And yeah, the experiences just keep coming here. Man, it's tough. There's no doubt. I think ICU delirium is the thing that is probably the most difficult to deal with emotionally. For sure it is, and should probably be talked about a little bit more. I don't know what they would do. Again, I want to be positive here again, but I think that people should sit down in the educational part of this, going into it, at least with your family, and say, look, we may have some issues here about that going on. Because when you're in an ICU for that long, you've been under that much anesthesia, that many pain medicines, the different things on board, it just puts your body in a shock, and that happens more often than not, actually. Again, I didn't experience it, but I definitely have witnessed it from time to time. Now, let me see here. Krista Wiseman Pauly adds, she wants to know that you can be at peace and you can, hold on, be at peace the best that you can for whatever may come your way. Every transplant journey is different. I appreciate Krista for throwing that in here. She's exactly right. We just have to get to a point where we have to just accept. We have to accept whatever our challenges are and stand up for them. And of course, we support each other in doing that. I don't know if you understand this. If you're a part of the Transplant Helper community, or in this case, the Heart Transplant Support Group, you got tens of thousands of fans cheering you on. We are your biggest fans. We got pom-poms in our hands, and we're doing cartwheels to help and encourage you, and we're here for you. But that definitely, yeah, we have to be at peace with whatever we're dealing with at the time. Jody Jones says concerning this, we knew about the anti-rejection meds, but not prepared for the medicine-induced diabetes, although it was not an issue. Now, I agree with this, and this is very common. we're going back to that drug prednisone. That's the most common culprit here. When you get on large dose prednisone, it can typically, and often does, temporarily at least, induce a medication-induced diabetes. I know I never had any issues with blood sugars, diabetes, or anything like that, not even pre-diabetic. And then immediately after transplant, blood sugars 200-300, spiking up and down, having to take insulin shots constantly in the hospital. Very difficult. Thankfully, most of the time, the damage is not lasting there. And when you come off the steroids, or come down from the steroids, I should say, things do get a little bit better. And I'm sure, hoping for you, Jody, that was the case. But actually, you said, although you didn't, was not an issue. But you knew about it. And for a lot of us, it is an issue. But they need to tell you about that. That's just something. And that would be a big deal to tell anybody. Just say, hey, look, after transplant, when you may be placed on some insulin or something like that, or some other drugs to help you with your blood sugars, because they may be a problem. And they certainly were for me and for others like us. Let's go on down here. Nancy, or Rails, I misspelled it, right? I don't know, Miss Nancy, my apologies. She says the lack of mental health support and support groups through the program. And yeah, there is a huge lack of mental health support, typically through the programs themselves. Again, these support groups are great, and some hospitals do work hard to have that, but they just don't have a lot of support out there. Now, there is support available in most cases that they don't often tell us about. There is counseling available. There are psychologists, psychiatrists, other things that you can go to. There are small support groups. The problem with that is, and one of the great friends of the program that's actually with our local chapter of support group, Stan Smith, could attest to this. Sometimes it's not the hospital's fault. It's not one person's fault. He's the president of that, but participation just gets low. And I can tell you that from experience in this channel, that when people, and I'm fine with this, okay, I'm not complaining, but when people are just barely out of transplant, they're active in the support groups, people are watching these videos, they're consuming the content, I'm talking with them, I'm having private conversations, phone calls, text, communication, and then as people come out of transplant farther and get better, they lose that need and they back out. So what happens is, when you have local support groups that consist of just local people, let's say, for example, UAB Hospital, the year that I was transplanted, there were 23 heart transplants that year. So I would say almost the maximum amount of heart transplant people willing to be a part of a local chapter of face-to-face meeting support group, the max would have been 23. The thing is, half those probably wouldn't do it. That cuts you back down to, say, 12-ish, 11 and a half. There's not a half a person, but that's the math. And then you take away the factor that some are doing well, some are not able to attend. Some, those support groups locally often don't do enough, and are not able to do enough. And there's a lack of mental health support. There really is. We as transplant patients sometimes are treated for our physical symptoms very, very well, but the lack of that mental support is there. And I know this comment's coming up, and if it hasn't already, there's a lack of discussing mental health issues as well. We're just not prepared for that. We are basically inadvertently come to the understanding that when I start to feel better, I'll be better. No, that's physical. That may be the case physical over time. Sorry, I keep bumping the desk, but that may be the case over time physically, but emotionally, the trauma there can be long lasting. And such as that. Let's see here. We're going over to another comment now. Alan Stansel says that there's a very small chance a donor family will want to connect with you. And he talks about his chest pain and different things like taste buds. What come to you, Alan, several times. Yeah, there is about a 50% chance. This is in general now. About a 50% chance that there'll be any connection between the donor family and yours, okay? Now, that comes up for a lot of reasons. One, both parties have to sign consent that they want that to happen. So you have to determine that in your time. They determine that in their time. And for some cases, it's just too painful, particularly on the donor side. A lot of families do make these wonderful gifts, and we're thankful for that. But then they tend to want to just cut that part of their life off, because that was a part of the worst day of their lives, probably. They lost their loved one in a tragedy, most likely, or it would have been tragic. It's tragic anyway, but maybe even a very sudden situation in many cases, heart transplants at least. and they just want to cut ties with that, and they want to move on with life, and they never come back. So only about 50% ever have any contact. If you go farther than that, a much smaller percentage ever have any real contact, more than just 1 or 2 letters exchanged. I know I'm thankful that I've known my donor's family really since about the 3rd month, when I immediately wrote them a letter. I did that the moment I walked out of the hospital. And then they wrote back within about 3 months, and we've had a great relationship since. I've been to their house and visited. They've come here, and we live in Oklahoma and Alabama, so it's a long ride. But we've gotten together several times. I speak with my donor mama about every other week, sometimes more than that, but we always talk on the phone 45 minutes, an hour when we sit down. I talk with the sisters and communicate with the whole family that's remaining. And it's been wonderful. And I wish that would happen more. I think it really does a lot to heal on both sides if that is possible, but it's a very small chance of that, as Alan says. He talked about the pain there. We kind of mentioned or hit on that a little bit. He also talks about the taste buds. He said how long it would take for my taste buds to recover. And yeah, they don't tell you about the taste bud thing either, do they? And that's terrible. I mean, I woke up at the transplant, and my favorite foods, now this is a blessing, please understand me. My favorite foods pre-transplant, please don't get on to me for that. Well, if you want to get on to me, I deserve it. My favorite foods were chili dogs, cheeseburgers, and pizza. Particularly pizza. First thing I got after transplant, my wife ran out and got me a pizza. I wanted to eat. She went and got me a pizza. Tasted horrible. Wanted to gag. Horrible. My taste buds had temporarily changed. And I mean, things that were sweet were super sweet. Things that were salty, like a pizza, super salty. I mean, it tastes like you just dumped the Dead Sea on it or something like that. It was horrible. Couldn't eat the stuff. Now, that helped me because I went to fruits and different things from that. It got me away from some sugars and some salts, and it helped me a lot. But those taste buds, man, I wish somebody would warn you about that and really give us that information. Tara Carney says how Tacro and Prednisone would attack my bones and make me unable to walk or use my hands. There are days I can't move. And yes, we're not told enough about that either. Even if you're warned about the effects and side effects of prednisone, that bone deterioration. I know I have osteopenia, which is pre-osteoporosis. I have osteopenia. I have to take some extra calcium type, medication supplements from time to time, but you got to be cautious with that. Calcium that you're trying to maintain your bones can also get in your arteries and cause havoc. Don't want that as a heart transplant patient, but yeah, they don't tell us enough about that and that it will attack our bones. I've got a good friend who's had hips replaced, knees replaced, shoulder replaced, I think. Is that right, Bo? I know the hips and the shoulder surgeries. It's been rough, and it's rough on a lot of people. That's over time, but yeah, if you stay on that prednisone for a long time, it does wreak havoc on your bones. Others chimed in and said, yep, this has happened to me. I'm now up and walking again, thankfully, someone says, but it does happen. Zakia Khan says, I don't know why, but they thought I would only have an incision in my sternum, or I thought I would only have an incision in my sternum. Then when they turn around and wake up with scars all over their body from the drains and different things, they were kind of shocked. And yeah, again, that's something that they don't always communicate very well with us about, that there are going to be, you're going to look like a pincushion when you come out of there. Your family needs to know this, by the way. You're going to have IVs, you're going to have drains in your neck, in your chest, in your groin. You're going to be covered up with tubes and different things. Of course, oxygen, a part of that as well. But those things are removed after a few days or a week, but it takes time to get to that point. And yeah, we don't need to be shocked by that. Bill Applegate says the potential cost of post-transplant medication. Boy, I feel you there. One of the medications I was on right after transplant was called Valsite, and that's because my donor had CMV, and so they immediately put that Valsite on board. It's an antiviral to try to ward off CMV being communicated or transplanted over to you. What is that? Infecting you, what have you. And that Valsite, this is back before it went generic, okay? I hit right on that border. It turned generic within about 6 months. That Valsite by itself, out-of-pocket costs for Medicare as well as Blue Cross Blue Shield insurance working together, $1,300. My first month of transplant rejection medications with that Valsite and others included $4,500 out of pocket with good insurance. They don't always communicate that. I think they do sometimes, as far as they tell you to have a certain amount of money saved up, and you think that money is to pay for the surgery or at least to pay co-pays on that. And it is, some of it. It's for your family to be able to survive when you're in the hospital for a long period of time. You know, food, hotels, things are involved, but a lot of it comes down. You better have some money in the bank for some medication. At least you get, you know, over those co-pays and out of those loopholes, is in or out of the loophole, whatever, to where you can get past that. But things do get better. Things go generic, and things get better over time. Cheryl Mazzola White, that I would get the shakes and tremors. I'm almost 8 years out. Now, she's the one I'm recalling here that had the tremors that have lasted 8 years, and people just chimed in to help and to try to help with that. But it's very, very difficult in that. Now, Vernetta House Davis, a great friend of the program, a longtime viewer, says, I believe I was told everything from the beginning of transplant, but I think my brain kind of shut down, so I missed half of it. And that's the case. You know, they do these transplant education classes. They happen very quickly. There's a lot to process, man. It's a tough time. You're always in failure when you're going through that, so you're not in the best physical or mental or emotional shape. And a lot of times they tell you a lot of stuff you just don't remember, and you really don't. Or if you do, after surgery, your brain kind of gets erased during the surgery, and you don't remember even in that. But that happens. Adrian Phillips, a great friend of the program, she says the same thing about the prednisone. Could possibly cause diabetes. That's right. Amanda Woodard, or Amy, I'm sorry, Woodard says, well, I imagined and dreamed of the complete recovery. And the reality is it can be a shock to many, but we're all given a chance at life, and we do not have before. It may not be the life that our minds expected it to be, but it is a life. That's right, Amy. Amen to that. It is life, and it's up to each one of us to make the new life the best that it can be. And I definitely appreciate that comment, Amy. For sure, I appreciate that. Jason Murphy, guess what he's talking about? The prednisone, the shakes, all the things that come along with that. The rage, I would add to that, comes in. He's sometimes driving to the store is difficult and different things. And Jason, you're definitely telling the truth about that. Lucy Killen adds to that. I was told that I would live the best life ever. Now we have dialysis. We're walking with a cane, nerve damage from surgery and different things. Lucy, that's unfortunate, but the real unfortunate part is not just for you, but it does happen. It really does happen. I've got several good friends, Ron Harbor being one of them, that had to have a kidney transplant as a result because his kidneys, quote, just never woke up over time. Howard Besson, we started this whole thing off with your comment. He said, the possibility of a dry run. Yes, yes, yes. On average now, and I get that this didn't happen to me. Well, it did. I had one. But on average, 3 dry runs is actually statistically average, okay? So there may be some calls where you get all in a tizzy and excited, and then that organ not be for you, or it go to someone else. In my case, it went to a man down the hall from me, and I was happy for him. I shook his hand on the way to the surgery, but it was a big disappointment as well that I did not get that organ at that time. Let me see here. Kathleen says, I was told just the right amount of information that wasn't enough to scare me or have anxiety over it. Nothing has really surprised me, she says, about this journey. Right in line with what they shared, there was an eye-opening to read so many of the symptoms and that affect so many of you, and I never imagined this could happen. I am blessed that even with the bumps in the road, I am alive. Thank God. Thank you, God, she says. Kathleen, exactly. We're all different. And I'm thankful that you have not experienced many of the challenges that some have. I have not experienced as many challenges as some had, but I'm thankful for that. Kathleen, I have to throw this in since you're promoting. She said, thank you for your YouTube channel as well. I've learned so many things, and I feel inspired with you sharing what you have. And thank you for that. Now, we've got so many more here. I'm trying to just look through. Let's do this one. Bob Giovanni says, I wish I had known about the increased risk of depression and anxiety post-transplant. Of course, I would have still had it, but a quick conversation would have been very helpful. Yes, the emotional side is so important and typically not talked about, whether it's anxiety, obviously depression, PTSD, which I don't know if anybody mentioned that here, but it's a part of it as well. A number of my friends have PTSD. I had a mild I guess you call a mild form of it for a while, and it's just tough. Christy Hazley Holmes says, there's really nothing. It's like reading about pregnancy and childbirth for first year parenthood. She says you can read all the parenthood books you want, and then after you have that child, it's a different world. And Christy, you're right about that. There's not a lot of ways to really forewarn all of these things. Different people talked about loss of relationships in that. Tim Clement talked about, here, I'll put his up for a moment, the odd dreams that he would have, and he had some sure enough dreams right here. You can go check the comments and read about his. So in that, let me see what else is here. I think we're about done. So let's see if we can get maybe one more. Tanya Bartley, I think I'm saying that right. Tanya Bartley says, I wish I had been told of all that would be a chance that I would grieve my donor to a point and it would cause depression. Yes, yes, yes. There is a huge part of us oftentimes that grieves as a result of our donors, the loss of our donors, and that will remain. Again, I have a great relationship with my donor family. That's helped me a lot. But there are days, particularly on holidays, birthdays, my transplant anniversary, which I want to celebrate. Sometimes I just don't want to celebrate because I know that my most triumphant day in my life is the most tragic day that my donor, Dickie, and his family have ever endured. And there's a lot of anxiety, a lot of grief and sadness that go along with that. And sometimes we need some counsel for that. We need some assistance in that. And it's just difficult. There's no doubt about it. No doubt about it at all. Oh, I got one more right here I missed out on. Ann Kelly says, so many things. It's all happened so fast. I didn't even have time to think or question. And that's true too. Sometimes, we're in a whirlwind is what I described, a whirlwind pre-transplant. Sometimes it's such a shock to hear the word transplant connected with your name. And things can be very, very difficult at times. But anyway, all of these things right here, just basically all of that, as long as it was in answer to this one question here. Well, there it is on the screen right there. This one question that came up. And what do you wish you had been told? So this is kind of another one of those videos, forbidden, the things they never tell you about transplant. Thank you so much for joining me today, for being a part of the program. Every one of you, I didn't read all the comments. I know I missed some, particularly if you got in the threads. Thank you for that. But I kind of hit the highlights, I think. But all of you who put comments and added to the conversation, thank you for that. Thank you for being a part of the Transplant Helper community, for all that you do. And to each and every one of you, please stay stronger, my friends.